According to reports, 350 suspected cases of cholera has been reported in 29 wards across multiple local government areas in Lagos State. 17 confirmed cases and 15 fatalities so far. How is the state reacting to these cases? And are the things residents of the state, what are the things residents of the state need to know? What are the do's and don'ts at this time? How do we identify a suspected case? What do we do if there is suspicion? What are the preventive measures? So many questions we have to ask. Joining us on the studio to speak on the outbreak of cholera in Lagos is a special advisor to the Lagos State Governor on Health, Dr. Mrs. Kemi Ogunyemi, DHA. Welcome to the show.
Thank you.
Good to have you.
Yeah, thank you.
I mean, we've all been scared. Could you just give us the numbers as of today, as regards how many deaths, how many infected, and across which local governments? Let's see the numbers so far.
Okay, so the good news, I'll start with the good news. Thank you for having me. Okay. The good news is, as of yesterday, so what happens is we get the reports on new cases the day after, like the morning. So this morning I got the report that we do not have any new cases.
Oh, great.
And we've actually been on a downward kind. We look at the trends.
Okay.
So that's the good news, that there's nothing to worry about. There's nothing to panic about.
Okay.
However, we still have to be vigilant. We still have to be on top of things. And that's what we're doing in trying to educate the public. And the campaign out there is how to prevent it from actually picking up again, especially after the Salah celebration.
So what would vigilance look like?
Okay, so vigilant, okay, so let me tell you from the government side. So we have surveillance, we have people from the environmental health services going around as we speak. There are people all over the place. So for example, you talked about the local governments. So we started from Lagos Island. Lagos Island has the largest, over 100 cases.
No, not
them.
Lagos
Island.
Lagos Island.
Not Etiosa.
Then we have Kusofe, and then we have Etiosa, and it goes down, all the LGs. But that's it. So around the 10th and 11th, we saw a spike in cholera. Don't forget there's cholera anyway.
Yeah.
It's not as if we have zero.
Right.
People have it. It's very mild. They go to the hospital. We don't really hear about it. But between the 10th and 11th of June, it went up in some local government areas, like I mentioned. And so we started monitoring. So that's what we're doing, monitoring. Where did this come from? Why did it happen? And that's the work of the government. And not only that, Lagos State Ministry of Health, we don't work alone. Okay. It's a collaboration with Ministry of Environment, because there are a lot of environmental factors, actually, when it comes to cholera. We're working with even education, Ministry of Education. And of course, we have partners. We've already told the NCDC. We had a meeting with Dr. Jide Idris, who's the DG of NCDC. We have UNICEF. We have the Red Cross. So many people on board. And so we go out there in the community to ensure that this is not going to spread and become something that we cannot contain. So right now we've contained it, and we're seeing a dip in the number of cases.
I know we've had cases of cholera. Cholera kills. Have you had any cases of death?
Absolutely. Unfortunately, we've had 15. So out of the 350, we've actually have 15 deaths. A lot of them have been brought in dead. And then you find out that this was what happened at home. And that's why we're trying to tell the public that when you have certain signs and symptoms, and I'll let you know that you must come to the hospital. Don't treat yourself at home. We're telling people in the community, heads of communities, that once you have these symptoms, please go to the hospital, because it is a deadly, it can be deadly. It's a deadly disease.
Can I catch it by touching someone that's infected?
No, so it's by contamination. So the bacteria is found in water, in food, and so contaminated water, if you drink it or you touch it, and you touch something else, and that's how you catch it.
So I was worried when they said it broke out, especially on the island. We've known for years that the water in that axis,
red water,
is actually brown, red,
brown,
and green water. And I'm wondering if there's any plan to see how that water can be salvaged. So a lot of people have this water treatment plants and blah, blah, blah. And it's very expensive to maintain. But most people do not have. And my mind just went to some of the reasons that could have caused this cholera. Is there any plan in the process to see how at least the water from that area can be a bit cleaner?
Yeah.
So when it happened, and we sent people out there to find out what's that. So the first thing you do when it comes to a public health issue like this is find out what's the cause where is it coming from? So we heard that some people, so there was a common denominator in about 10 people who had taken tiger nut, and I'm not trying to knock down tiger nut right now, but I'm just trying to say that there was a few people had that. And then, so we think it's obviously it's a waterborne disease. So it's like, you can ingest certain foods. So you can go to maybe a party, you have salad, and it's contaminated, and people get it. So we need to find out the source so that we can actually stop it and reduce it. What the government is doing when it comes to water, and you're very right, and it's been on the plans for works, is trying to ensure that we do have clean water. So I know the GM of the Water Corporation is working very, very hard. It's going to cost, we're talking about a 20 billion naira project where water, clean water is coming out into all the communities in Lagos. And you know, Lagos is big. Lagos is congested. So many people stay together. So you have the boreholes that are just, or the pits, or the wells that people use. And then rainy season, we also know that there's an increase in cholera when it comes to rainy season and all that. So, but that's what the government is doing. We also have a WASH program. So it's water, sanitation, and hygiene, where we're trying to tell people, wash your hands, clean your area. I mean, the government, we clear the canals and all that, and people still drop things in and block it. So there's so many things that government is doing, but however, we also, as a community, the people, have to just be not only vigilant, but make the environments clean.
Let's talk about the symptoms for a second, because, I mean, over the weekend, trust me, I mean, let me just confess to you, at the parties, we attended a lot of parties, and they served myself and my husband salad. And somebody said, there's cholera in town, why you eat this salad? I said, Auntie, after I finish this one, maybe the next one. So Brown had 2 plates, I had 1 plate of salad. And then on Monday, he had tummy upset, he was in the toilet. I was laughing at him all day, not knowing that my own was coming in the evening. Last night, all till this morning, I've been in the toilet. So what are the symptoms? I'm hoping that God, please let it not be cholera, because I chopped this salad, I chopped meat, plenty. So tell us, what are the symptoms? What should we be looking out for?
So for cholera, so one of the symptoms is abdominal pain. So there's abdominal pain, feeling tired, fatigue, and of course, watery diarrhea. You can't have. You can't have diarrhea. No. Mariah is sitting down here, and she's good. She's good. So increased heart rate, vomiting. Fever or not?
No.
So you see she's crossing them out, there are no checks. And general malaise. And when I say diarrhea, I'm talking watery diarrhea, just continuously. And you're losing a lot of electrolytes. So the body gets weak. You get muscle spasms or muscle pain as well. And so all those things, I will even tell you that I'm not feeling well. And I've got that diarrhea, of course, and the vomiting is number 1, classic. Just go straight to the hospital. We usually just go to the chemist, to the pharmacist, and then the pharmacist will say, oh, what's wrong with you? And then give you antibiotics. Do not take the antibiotics. No. Go to the hospital, because we need the sample. So what has happened with all this is that people just go to the chemist, and then the pharmacist will give them antibiotics. Yes, it's part of the treatment, but we want to get a sample, which was what delayed us a little bit, about a day or 2 before we came up with confirmation that it was actually cholera. And we needed to find that out. But the most important thing is hydration, rehydration, because as you're stooling and you're passing so much and vomiting, you are losing so many electrolytes. That's why your muscles also get tense and painful. And that is where, and then, of course, the body is deprived of fluids. You go into your kidneys, start failing. We have people on dialysis because of cholera.
If you are vomiting and the water or the ORT that you are taking in won't stay.
No.
Because you're vomiting.
No, but you can take it already. But if you go to the hospital, it's IV.
Okay.
So, but the whole idea is that you're losing so much water, you've got to replace it. Because if you're dehydrated, your kidneys are affected. And like I said, we have some people on kidney dialysis because of cholera. And those who have died is because they've gone into shock, the kidneys have started failing, and and they had underlying issues. And it was not,
So the question I was going to ask is how long, because sometimes, you feel a little ill and you feel like you have a few more days before you get to the hospital. How long do you think you have from the moment you start noticing symptoms? to get to the hospital?
As soon as you notice and you have those symptoms, you go to the hospital. Don't wait and say, let me see how, oh, maybe in a day, in a few hours, I'll feel better. No.
Then let me ask you, let me even ask you my proper...
I will say something,
Okay.
sorry.
Go ahead.
Any public health issue, disease, or infection, it's free. You don't have to pay for it.
In a public hospital.
In public hospitals,
There's
you
space.
go in, you're free. We will treat you.
They attend to you immediately?
Yes, yes, we will.
Center
We
at
will.
Yaba.
Exactly. There's a dedicated area. Yeah, you see, she's got her
Yeah.
information.
Yeah, but let me ask you my proper question.
Okay.
Our children are going back to school.
Yeah.
How is the Lagos State government working with schools to make sure that children are kept safe during this period?
So remember I said we've been having meetings every day. And the Lagos State Ministry of Education, the commissioners have also been with us, as well as environment. And we mentioned about schools, because they're all coming back. And they have a quality assurance team. Everybody is aware of this cholera outbreak. And they have their own processes, really fast, really effective, to all the school heads, all the school teachers, everybody, that please be on the lookout for this. If any of the children come in sick, send them straight to the hospital. No, not necessarily back home, just call their parents, because children are very susceptible to losing a lot of, getting dehydrated and falling very, very sick, very, very fast. So the education system has already got something in place.
Okay.
And of course, like I said, we were watching the trend. If it was going up, we would have probably made a decision that, okay, we have a problem here, but for right now, that's the good news.
Fantastic.
It's not,
Let me take this call from Mary Jane. Good morning, Mary Jane, you're live. Thanks for calling.
Good morning, hello.
Morning. Oh, you're alive. Oh, we lost that. So when I was saying that, this is Nigeria, because most Nigerians, the last place you want to go to is hospital because of all the names of the extra cost. So for someone like me, in the last 48 hours, I just took ammonia from her this morning, because I won't, my first thing is not to go to the hospital. It's to observe, because when we were growing, I said, after 3 days,
consult your doctor.
So if symptoms persist,
after 3 days,
it's in our DNA, in our subconscious. That, okay, let me wait.
Symptoms.
If by Wednesday I still feel the same, it's a possibility I'll definitely go to the hospital. So again, should we continue that if symptoms persist for 3 days, or the moment you feel once more, Nigeria, no matter how headache is,
your symptoms were not, you just had abdominal pain, maybe you had one loose stool.
Yeah.
I can see how people say, okay, let me watch this. But honestly, it's actually fast. Within
You will
an
know
hour
something is different.
You will know.
Okay.
You will know. Because you're talking about, we always say that diarrhea, or when to report to, is anything more than 4 loose stools in a day. Think about it on average. Maybe 1 or 2 times you go to the bathroom, whatever. By the time you get to 4 or 5, you already know that something's wrong. And then you can even trace yours to salad.
yeah, of course.
Yeah, so
And
this one,
ram
people
meat.
don't even really know when they drank the water, what happened, but we're just saying that there's something out there. And it's good people are saying, there's cholera out there, be careful. I like
Let
that.
me take Fatia and I'll come to you, BC. Fatia, thanks for calling. You're live. Good morning.
Good morning.
Yes, go ahead, please.
I want please, I'm about to talk about this cholera outbreak, my opinion on it.
Okay. Come here.
Actually, the water that we are using is not as if it's coming directly from the source. Like, there are some these malams that put drugs.
Fatia, it's so hard to hear you.
Yes,
The water you're using is not from government, you said?
exactly. There are the malams that push drugs.
Okay.
So, this is going to affect us, like, the cholera stuff. So, because you guys work on the water that we are using.
Oh, from the malams that push the trucks, that's where you get the water from, okay?
Yes, exactly. Their water are not really good. And we use some to cook.
I can't hear Fatia, but I think she's just talking about the water, the sources.
Where they get the water from, so what do?
Yeah.
You boil your water before. This is ingested water. We're talking about water you've taken in. So boil your water before you drink it, or even, and then make sure you have proper cooked food. So sushis and all those ones are
Time to
out.
eat it.
No,
Nigerians
the-
are
Nobody
not
can
the-
even afford sushi.
Can't
right?
do
those
afford-
of you that can afford sushi, I'm just trying to
nobody.
say avoid
Even
raw
ramen,
foods.
you
don't
can
like
start
sushi.
I don't like
Are you
sushi
okay?
either.
If you say
On
anything
national
here,
television.
if you say anything, I'll
Wait,
punch
can you hear what she's saying?
I will punch you.
Let me keep quiet.
But let me ask the question. So we buy water, so sometimes bottle sachet waters, and we're not really very sure about the source. Is there any thing the government is doing to ensure that the bottling companies, the sachet companies are, taking hygiene into consideration when selling this water? Because I've had an experience with buying sachet water. That was why I stopped a few years back. I finished taking, while I was taking the water, I noticed it was a bit slimy. But I was very thirsty, so I took it. And then all through that night, I did not sleep. And so we had to ban that. But a lot of people out there cannot even afford the bottled water. So is there any way to help us make sure that these people are hygienic?
NAFDAC. All those bottles have a NAFDAC number. It means they've gone through the rigorous process of ensuring that it's safe.
Just stick
Even
any
the
number these
sachet
days,
ones,
have.
Uncle?
Safe.
means it should have.
Anything you eat, anything you drink has to have, in
NAFDAC,
packets,
yeah.
have to have a NAFDAC number. I would take you back to the tiger nuts and be open about it. When we found out that there was it's a possibility that it was from tiger nuts, so we got the bottles, the environmental health people got the bottles. There was no NAFDAC number.
So the tiger nut milk.
The tiger nut milk, there was no NAFDAC number. So it's like, there was a number, an address, and they've been going every day, but because of the holidays, I think all of a sudden, you just don't find them selling it anymore. Maybe they've heard, but it's coming from somewhere, and somebody is, distributing it everywhere.
They're using contaminated water.
Correct. So, but NAFDAC does all that, what you're asking for.
the checks.
They test, they check, they go there. And so, but otherwise, if you're getting your water from the well, when you boil the water, cover
Let me
it.
take this call from Latifa. Good morning, Latifa. Are you still there?
Yes.
Please go ahead. You're live.
Hello?
Morning. You're live. Go ahead, please. Okay. Oh, sorry. There's a message for you here, doctor. Somebody sent me, said that on this issue of cholera, there's an issue of open defecation in Lagos, especially in Bega area.
Oh, wow.
Lagos state government need to act fast on this. I still see people doing this act as I was leaving Lagos this morning. This is from somebody who's so near that Bega area. There's open defecation. There's a possibility that cholera can spread.
Absolutely. Cholera is very, very right, and that's one of the things that the Ministry of Environment is looking into, because they are going to provide mobile toilets. But with the mobile toilets, you need running water.
Yeah.
Remember, I told you that it's in the pipeline. So the pipes, some of the pipes are broken, some need new pipes. And obviously, areas that are definitely like that area will have a lot of this. I can't remember how many the Commissioner, Tokunbo Wahab, was talking about yesterday, but it's quite a lot. And that's the plan all over Lagos, where we can have them and tell people the toilet is there. Because you know Nigerians, you know Lagos. I wouldn't even say they're Lagosians. People come in from everywhere. Even if the toilet is right there, you probably find somebody.
Yeah.
know,
So used to
over
it.
there. But we have laws, we have rules, and we have to ensure that we actually make sure that people obey the rules.
We have this problem at Shrine because there is a canal beside Shrine, and people go
from their
into
toilets.
the canal
Poop.
and they poo there, and it's really. I mean, if we catch them, we drive there. And you see, the worst part is the toilets at the Shrine are open, so you can go in there.
Oh, wow.
Rather go to the canal.
They would rather go into the canal and it's so terrible because it's my boys that have to clean it. So it's so terrible. So I think that you need
Enforcement.
It's not just enforcement, sensitization.
Yes. Yes,
You know, if you don't sensitize them, they will continue to do it. People just don't. We are so used to living like that that we continue to live like that.
Absolutely.
So we need to start to sensitize. And then the water is so, because I went to Benin the other day and I had to go to the bathroom to wee. They didn't have water.
Yeah.
You know, I mean, I was just going to wee, so it didn't really matter. But in a way, it matters because I want to wash my hands after.
Right.
Let me take this call from Francis, calling from Uyo. Thanks for calling. You're live.
Yes, good morning.
Good morning, sir.
I want to ask the guest there because this our Nigerian system of outbreak is giving me concern because it looks as if once it happens in one state, you hear 10 people. All other states, you begin to hear it. And I've been reliably informed that this thing is not transmissible. It's not like, it's not something you touch. But I'm wondering, is it that after some time, the virus will die or the bacteria will die? And it has a particular time the bacteria will rise up and spread in 30 states. Because it's like conspiracy theory where once it happens in one state, all other states will now be affected. Okay. So they should explain to me whether the bacteria goes on break at a certain period and comes back. Okay.
Thank you very much.
It is, and you know what? It's very interesting, and we actually touched on that with the Commissioner for Health yesterday. As far as we know, started in Lagos, but people go to other places. So we think we spread it to Ogun State or your state, but it's spread through people. Yeah. So once you're infected, your hands are already dirty. You touch. Let's, for example, I'm in Lagos. I've got cholera. Maybe I have got diarrhea. It hasn't really kicked in as such. And then I touch grapes, and then I give you, in all your states, I come to see you in Ibadan, I give you some grapes. You don't wash your hand. You don't really wash the grapes. And the bacteria is on it. Or
you touch the grapes. Yes. And the grapes go ahead of you to Oyo. You don't even have to follow it.
True. Seriously, and that's how you had salad. Maybe some people took some lettuce, whatever. It's contaminated. It's contamination. So once something is contaminated, that's how it spreads. And that's how we believe it went to Oyo State, Ogun State. From Ogun State, somebody else will spread it. But there are not as many cases as we have in Lagos.
Let me take Kane from Owe. That comes to you, Mariam. Kane from Owe, you're live. You're live.
Hello.
Good morning. Yes, sir.
Yes, as I was watching the program, my attention was drawn to Kara, where we, after
they buy meat.
After the long bridge. So when you are, if you are passed through if you are passed through Ibadan Expressway going to Lagos, when you get to Kara, before the river, before a river there, in between the road, the way people defecate there, if you see the pile-up of feces that is being deposited in between the roads, these newly constructed roads. Hi. And when it rains, water will wash everything inside the river. Oh. And that is the river where people are killing, where the cows are killing and other things. People are using it to wash meat and do other things. I wonder if such a thing is around the corner now. I don't know how they could be curtailed. So I want the attention of the government to be drawn to that effect. So that something can be done to it. Just before the river.
Thank you very much, Mr. Ken. I mean, that's Ogun State, really, but I know that Lagos State has a very close.
Go there. Kara, I've heard Kara over the news in the last 3 days. Every day they've spoken about that place where people are just defecating. I know. Yeah, I think it's so terrible. They really need to do something about it.
Like I said, it's an environmental issue, and that's why health and environment go together. And trust me, they are looking at it and all these different things. And your callers are well, about the environmental impact. Yeah. So they're very knowledgeable about it.
But if you find yourself, you bought meat, what would you advise? So you cook your meat properly?
Absolutely. You wash it well, you cook it thoroughly, and that's it. And you wash your hands.
We have the fruit vendors, and we've seen videos of them just taking water from any open source and just... Yeah. So the advice to Nigerians...
It's the same thing. We're not going to ban fruits or anything like that. You and I, everybody, all your viewers listening, wash everything that goes into your mouth. It's as simple as that. Yeah. Wash your hands. Everything that you put in your mouth, whatever it is, even for children, you make sure that they wash.
I had to call my girl yesterday. I said, baking soda. When you bring the fruit, wash it before.
Yeah, baking soda.
I was laughing. I said, it's not funny. Alice, it's not funny. You have to wash it very well.
White vinegar.
And especially after going to the bathroom.
Yes.
You must wash your hands. You go to the bathroom, you come, wash your hands properly, not just...
Let's talk about how this thing is cured. Because many people feel that, as you said, we should all go to the hospital. So you said that also the people who died is possible because it affected their kidneys and they were totally dehydrated. But it's expensive to treat because people always get scared when they hear cholera and they feel like, I'm going to be spending money. I don't worry, I'll drink Agbo in the house and I'll be okay. Is it really expensive to treat?
It is free.
Oh, it's free.
It is
Government
free.
hospitals.
Public health issues like cholera, you come into the hospital, you don't pay a dime.
Oh.
It's on the government because it's for our own interests. We do not. It's something that is out there in the public interest. We want you to come in.
Yeah, but you won't know it's cholera until they run a test.
When you come in, because right now we know that's what's going on.
Okay. For now,
we know what. Yes, it's not that you come in every time.
I like that you're saying it's free, but I have to tell you the truth. I've heard of so many occasions where people go to these hospitals, the public hospitals, and they can't get treatment, they can't see a doctor, they are ignored, they die. So many stories I've heard like that. Right. And it's only, there's this, one of our dancers, her mother was ill. She took her to, I think, Lasuf, and she didn't get treatment. She ended up in a private hospital where, of course, she died. Okay. Because nobody... So I hear all this, it's free, but what is the how efficient are these hospitals? Let's be honest.
So, free is about the public, about cholera right now that I'm talking about. Okay. If there's another underlying condition that is other than cholera, we are trying to encourage people to go to their primary healthcare centers first. See, everybody rushes to Lasuf because unfortunately it's the only tertiary hospital we have right now, but there is in the plans to have more tertiary hospitals because we do have large hospitals that could be tertiary. So we're working on that. But everybody rushes to the tertiary hospital Lasuf. So it's obviously over. I mean,
they're overwhelmed. Yeah.
Yes, overwhelmed. We have shortage of staff. So we always say, you feel something, you feel you need to go to the doctor. Primary healthcare centers, we have lots of, go there first. They will refer you to the secondary hospitals. Secondary hospitals, we refer you tertiary hospitals. That's how it works. And I'm sorry about the person that you lost.
Let me take this call from Olu Yemozu. Hold calling for a while. Yes. Good morning. I'm so sorry.
Yeah, is there like a vaccine for cholera, especially for children?
Yeah, so there's an oral vaccine, which it's not like as if we're saying, go and get that now. But there is one, and usually, like people like WHO, you have to have data, lots of data that, okay, this is becoming an outbreak that we don't want to lose control over. And then when we do control it, how do we protect people? So it's something we're looking into. There is a vaccine. It's a tablet, but we don't have it. Yeah, so I'm not going to say people should go to the hospital and go and get vaccinated. But wherever they can get vaccinated, absolutely, you can take the oral vaccine, but we are looking into it. We will have it for people to,
we have to wrap up an option. But we need to see that Lagos State is also, I mean, we see the work you do. Sometimes, it's one thing for the head to say we're doing this. One thing when you go to the hospitals, the cleanliness, there wash hand basins across the hospitals, even at these primary health centers, even in schools, even in Alausa, how many of these do we, it's one thing for the government to say they want to do this, but how have you been able to sensitize even your own people to lead by example? Such that we're seeing that across board, lots of these public servants are also paying attention to.
And we are doing a lot, thank you. The governor is very concerned about ensuring that it's part of his Themes Plus agenda that we have access to not only quality care, but affordable as well, because it's one thing, and it costs money. There's a lot of money. Health is almost like a business. But one of the things he did last year was that, because Lagos is so huge, he divided the primary healthcare centers into 6 districts. Okay. So we have permanent secretaries in each district to make it so you have a smaller portion to focus on. And so we have like healthy competition going on there. When I say healthy competition, we just want to make sure everything's standardized and that we have procedures that are equal. So when you go to one hospital in the island, you should get the same kind of like treatment in the other one. Right. We are working into customer service for all our staff because people do complain that the doctors or the nurses, they're rude to them. The waiting list is global. The problem about waiting list is not just a Nigerian problem. it's global. You go to the UK, everybody complains that it's one of the indicators for quality, and we're trying to improve that. And of course, with people with the jackpot syndrome, it's obviously...
How are you coping with that?
So one of the things we're doing is task shifting.
Okay.
So task shifting meaning that there's some roles, some duties, some jobs that maybe the doctors can leave and the nurses will take up. They'll be trained and take up. There's some that the nurses will leave and give to community health workers. We can't cover all the primary healthcare centers. So the comprehensive ones, we have doctors, we have nurses there. But the smaller ones where they do family planning and things like that, we'll train people to be able to take over those roles. And that's the only way. And then, of course, now, you know, we're looking to start a new health science university where we're going to double the number of people that we train. So, you know, we're training 1,000 doctors, 1,000 nurses, pharmacists, medical lab scientists, and hopefully that one is taking shape now. You'll hear more about that later, but that's what we're doing.
You sound as if you jackpot from there to here.
I jackpot back like 10 years ago. Okay. Absolutely.
You sound...
Thank you for coming.
Oh, thank you.
Yes.
How has it been jackpot out to Nigeria?
It's fine. You know, my kids, they left the house. They're all married now. My husband is a medical doctor too, and we just...
You're just two doctors in the house?
We just said, well, I'm actually, my doctorate is in healthcare administration. I actually have a nursing background.
Wow.
Yeah, with the oncology, I lean towards oncology cancer care. Okay. So we came back and it was like, okay, we're done in America, time to come back. And then we came back and the rest is history.
So as you sit like you have children that are married?
I'm a grandmother.
Oh my goodness.
Wow.
16, like what?
Whoa.
Oh my
Thank
goodness.
you. I'm a grandmother.
Wow.
So I'm a Nigerian. I'm a Lagosian, by the way. I love to give back. And there's potential. And in Lagos, we have a fantastic governor, Mr. Babajide Sanwo-Olu. I'm not just saying that because I'm in his cabinet, but he does care a lot. And so he listens. Is like, what do we need to do?
You're deflecting. Don't worry.
I'm not deflecting.
Because you're talking about your husband is in the studio. So we're talking about how is married life after many years. How many years?
After 37, 38 years.
What? Oh, my Lord.
Oh, yeah.
Oh, so how is it still being married to the same man for 30 years?
You brought her to the
What
studio.
kind of stupid question?
You brought her here.
That kind of question.
You brought her here.
Ask her when she's not wearing this Lagos State badge.
I am.
I said we should ask you this question when you're not wearing Lagos State badge.
Wow.
When
No,
she
she
comes
does
and
not pay us to come here. We're talking now that we're gisting with you.
We've left cholera.
We left cholera.
Everybody's happy.
Cholera
Yes,
is
we're happy
we have
now.
good news. So how has it been 38 years with one same person?
It's good, but it's, you know, you have to balance. And of course, grace of God, by the way.
Yeah.
Yeah, you got to pray about it. But it's balancing things, being tolerant. You know, we're two people who, you know, when you get married, you're two people raised differently, probably, have the same ideas, so that when you do have the issues, you know how to cope with it in terms of giving. They always say the woman should be. So I'm not that.
I thought we were going to say it's overwhelming, blinding passion.
It is
For how many
passionate,
years?
But it is also, but I mean, look at the good things and you look at your lives and you know, you're fine.
Does the
The
passion
husband is actually blushing
does
behind
the passion ever die?
well,
It fluctuates, right?
You know when you're going through that menopause.
Oh,
the
yeah.
period. So you have to make sure your spouse understands. That this is what's
And he's a
going
doctor, he would
on.
understand.
Yeah, being a doctor doesn't.
He's a man still.
Thank you. So you have to let him know that this is how
what's
I'm
going
feeling.
on.
Thank you very much.
Oh, my Lord.
Please tell them, tell the men.
Tell the men what they need to know.
Yeah, they need to know that this. When it
have
comes to
phases.
you know, menopause is a whole new
Yeah,
show. But the men do, and in fairness to them, because some marriages have broken up because of menopause,
Wow.
because both of them just didn't understand. So first of all, the woman needs to understand this is what's going to go on in my body.
Right.
I'm going to have loss of libido. I'm going to be irritable. I may be irritable. I mean, you have to tell your children because they'll think you're the witch. All of a sudden, you've changed, and those hormones have gone. Your skin is dry. You find sex very, very difficult,
Bring it
very
back
painful.
so I think we'll bring it back
different.
for men.
No
No,
problem.
And also midlife
it's
crisis for the
been
men.
Okay,
For the
there's
men as well,
andropause as well. Andropause for the men as well. Have you...
I believe, I mean, sometimes when I've argued, I say, you know what, I think you're the one going through a menopause. I think you're
That
the
is
one going through, and then
all
we
we
just
can
like,
take on the show.
thank you very much.
Thank you so much.
Thank
It's
you
a
very
pleasure
much.
having you on the show.
Thank you. It's a
Hope
pleasure.
we learned a few things as we have good news from Lagos State government. They are on a downward spiral with cholera. Hopefully,
Absolutely.
you don't get an increase. There's no spike, but please remember to wash your hands. Be careful whatever goes into your mouth. You know, wash it, clean it, spread the news out there. We have to be careful. And those with the open defecation, I'm hoping that government is going to start helping us
and they should
address that
and
as
stop
soon as
people.
possible.
You
Please
can
stop.
stop them yourself.
That's all we can take. Have a great day. We'll see you
Thank you.
tomorrow.
Talk about woof.
Bye for now.
Thank you.
Bye.
Bye.
I've cleansed